Ki khubor ka Batesi TV ka umdi basnyam bak penjaslian. Rupa Premium Meghalaya.
Ka Employees State Insurance Corporation North East Zone ka Tarik Ïaïong arajar punriu klapen mena ban Pyntreikam make Employees State Insurance Scheme ha Baroh ke district jonga jila Meghalaya ka basdang Naduh ka Tarik Ïaïong arajar punriu ka balong ka sinjam ka bakongsan na kabentaginong tre ha Baroh Kawei ke jila ha bakran chikilap thai kubor u Insurance Commissioner ke North East Zone Uprani Sinha, lapan pau bagi Employees State Insurance Corporation, kelat hau ke network, ke baklan, habarok kuai keri, ke bakintup, ya ki spa anrupsan ligi hospital, pelat katsan spa atli ke dispensary, bat pelat praspa atli ke tenan office, ban pin dikena, bagi nong tudekin yo, ya ke jing sumar, bat jing mentoy ke besok, bat ke bestad. Lebanjur bagan ke skim ke doni ke jing lang ke biadai hapering ke sorka pedeng bat ke sorka jela ban ya dai ke jimentoy jing nong tre da ke paai ke jing ada hakaliang ke koi ke khia bat ke pisah ke tingka.
I'm Pranasina, Northeast Insurance Commissioner from ESIC. I'm located at Guwahati for Northeast region. I'm also having additional charge of East Zone, for which head office is at Karachi. So right now we are here to discuss about the new implementation of ESIC scheme in whole state of Meghalaya from the 1st of April 2026. About ESIC, I would like to explain in brief that ESIC is Employee State Insurance Corporation. This scheme is a social security scheme of Government of India, which was implemented in the year 1952, having been passed by the Parliament in the year 1948 itself. One of the first social security schemes of the country. Through this scheme, we have a partnership of center and state to protect the workers' interest and provide medical benefit to the workers and cash benefit to the workers. Cash benefits comprise of sickness benefit, maternity benefit, partial and full disablement benefits, and death benefit of the worker, for which dependent pension is given to the dependent of the worker who is deceased due to employment injury. ESIC is having the coverage of 4.1 crore workers all over the country, with beneficiaries covered under Esic to the tune of nearly 16 crores. We have a network of 165 hospitals, 1500 dispensaries, and more than 800 branch offices to cater to the needs of the workers, so that we are able to reach to them and give them best possible benefit of ESIC scheme. As regards Meghalaya, we have in implementation of the scheme since 1980, when it was first implemented in East Khasi Hills. Later on, it was implemented in Baroh district. Last year, November 1st, we got it implemented in 6 new districts of Kawei covering West Jaintia Hills, Tura covering North, South, East, West and Southwest Baroh Hills. This was implemented from 1st November 2025. From 1st April 2026, we have got ESIC implementation in the state of Meghalaya in Nongstoin, West Khasi Hills, Southwest Khasi Hills, East-West Khasi Hills, and Kelrihat covering East Jaintia Hills. So now from 2 districts implementation in up to last year, we have covered all 12 districts of Meghalaya. So ESI scheme stands implemented in the whole state of Meghalaya now. So we have to plan with the cooperation of the press, with the cooperation of the government, so that this scheme is implemented in a smooth fashion and we are able to give benefit to all the workers of the state. For giving benefit to the workers of the state, the basic criteria is the workers should be covered within the wage ceiling of 21,000, and employer having worker working with them for 10 or more workers, they have to get themselves registered with ESIC mandatorily, because this is a government parliamentary act. And ESIC is an autonomous body under the Ministry of Labour and Employment, Government of India. All this implementation and these developments, so fast development, are because of our Honorable Labour and Employment Minister Sri Mandavia, who had a clear vision given to us that ESIC needs to be implemented in all the districts of the country, so that ESIC is able to cater the benefits of medical as well as cash benefit to the workers within India. So in line to this, you can see in last 6 to 8 months we are able to come from 2 implemented district to 12 district, thus implementing in Meghalaya. Apart from this, as a measure for giving better secondary care, because we have a already system of 165 hospitals. Apart from this, we have around 18 medical colleges also which has come up under ESIC. So one hospital land has already been provided by the state government to us here in Ïaïong itself, where a new hospital will come up. Just handing over of land is we are awaiting from state. Then the work for construction will start. So that will be a great support to the workers of the state, because they will have their own hospital here. One more benefit, major benefit I would like to explain to you. This IP ward benefit is there in medical colleges. ESIC is having more than 1,000 seats right now, which will increase further, in which there is seat reserved from NEET quota, NEET UG examination for MBBS, seat reserved for the children of the ward of the IPs. Workers' children, if they even perform lower than the rank required for admission in this MBBS colleges, if they can get advantage of getting admission in ESIC medical colleges through a lower number, because there will be competition amongst the workers' children only. This is the great advantage given to ESIC. So apart from this, the other initiatives is that we are going to open some more branch offices. In some districts we are missing, some new district. First we have to go for survey and implement, and we have to extensively advertise so that all the employers get themselves registered with ESIC, so that no benefit is denied to the workers working for them. That is our main criteria. And then we are also working for extending this camp office. This camp office was also formed only 1.5 years back. So after formation of camp office, we have a senior officer sitting here, so that the work of within the state can be completed from here, most of the work, and for some work they have to go to Guwahati. But right now there is already initiative for upgrading this camp office to sub-regional office. We are expecting that it will also come up shortly. When it comes up, we will have a big office here, so that we can give better service to the workers and the employers, all the stakeholders of the state. This is the present position. Now 28,263 workers covered under us, and 1,982 employees are covered. That needs to be, I think, as per the projection, it should cross 50,000. For that we have to work hard, and we have to give better service and extend our presence everywhere. Actually, since it was in 2 districts only, people were aware there. You can see out of 28,000, nearly 20,000 are in East Khasi Hills only, because this means that it is well known to people here. But similarly, around 5,000 are in Rivoi. So similarly, in the new implemented districts, we are sending our social security officers and their inspector to meet the employers, tell them to encourage them to get themselves covered under ESIC. So slowly, and we are also going for awareness camps, preventive health checkup camps in the dispensaries and DCBO, so that people come to know about ESIC and more people are registered. Ultimately, by mandate, they have to do it, but we are not forcing right now. So we are requesting people to come up. For that, advertisements also, it has been issued also, and follow-up advertisement will be there. We'll have hoardings and mega campaigns also, mega awareness camps also, where many employers, bigger employers will be called and they will be requested. So we are planning to increase this coverage. Dispensaries there, that is the settled districts. I don't think Rivoi there is much of a problem. Rivoi and East Khasi Hills, it is settled, people know. But for other new implemented districts, we have to extensively campaign so that all people know because once the people know the benefits that we have, they will certainly try to come, because it is a real social security protection. Maternity, to it is the maximum around 80% of the cash benefit goes in maternity also. This means females are more aware.
Highest in Northeast.
Are the highest in Northeast. So they are taking that because full 6 months salary is given with leave, full leave. Employer cannot call them. This is Jowai Tura. This is implemented in 1st November only. So number is very low right now. Jowai to we had a health camp also, na short
Yeah.
Kab hua tha? When it was we
In the
started
month of-
health checkup and
in the
then,
month of-
in the month of October also, and right now some people got
In the month of February.
checked up also in February. So we are trying to through.
This is why total employee 52 to 105 employees.
So 205 employees are right now registered in Jowai. So this number has to increase. It has to. I think the target should be at least 3,000, 4,000 in each district. This is what we plan.